Now we're running.
Okay, now we're running. So I officially call the meeting to order for the December 10th, 2014 for the Oregon Health Authority Medical Marijuana Program Advisory Committee on Medical Marijuana. I just like to start as usual to go around and if we could have everybody introduce themselves, and I'll go this way, go to the right.
Seth Crawford, 46 person.
Todd Delato, Canada Research Education and Consulting in Corvallis, and chair of the Dispensary Program Committee.
Do you want to go around this way?
Yeah, keep going there. Did I get you guys?
Tawana Nichols, the Medical Marijuana Program Section Manager.
I'm Eric Kossel, I'm the Program Analyst with the Oregon Medical Marijuana Program.
I'm Tracy Candela. I'm the Section Manager Assistant for the OMMP.
Paul Schmidt, advocate. Larry Funk, retired and retiring.
Cheryl Smith, I'm an advocate, and I'm a director for Compassionate Oregon, a patient advocacy organization.
Ben McInnes, and I'm an advocate. And
I'm PK. I'm from Salem, Mercy TV. I record these meetings and it's shown on Channel 23, Comcast in Salem. Next.
Mike Rockland, I'm a private practice sergeant.
Go ahead.
I'm Sheriff. I work for OMMP.
My name's Ethan and I'm just a patient.
I'm Noah with Canada Security.
Allegra with Collective Awakenings, a patient and an advocate.
Greg Clinton with Time Mountain Organics, wholesale company.
Jim Vermeer, patient grower.
Kelly Page, I'm with the Oregon Health Authority, and we're talking about a new outreach program for getting people enrolled in healthcare.
Thank you.
Great. Thank you guys for all coming. I appreciate it. So, first.
Can I pipe in just a minute?
Oh, yeah.
Yeah, hi, Jerry Lehrberger, calling from Ashland, Oregon, advisory member, chair of the research committee.
Great, Jerry. Thanks
Good to hear
so
from you,
much.
Jerry.
Good to hear from you. Thanks for coming online.
Is there anyone else on the phone?
Is there anyone else on the phone?
Nope.
Nope. I guess that's it. Okay, great.
But we got 7 members.
We've got
So we
7
have a
members.
quorum.
So we have a quorum. We have 1 over a quorum. Woohoo! So I guess we'll start off with the approval of the minutes. Has everybody got a chance to review them, and were there any additions people would like to go over, or alterations or changes, amendments to?
Just one minor one on page 2, down at the bottom of that first table, summary of meeting motions. Just the MMD subcommittee, that should probably be the dispensary program committee, I think is what we call it in.
Yeah.
MMD, that's what Medical Marijuana Dispensary.
Yeah, it should be.
Where is it?
Oh, at the page 2, the bottom of the first table, summary of meeting motions.
Oh,
Just-
you want to spell it out, is what you're saying, the MMD?
Dispensary program committee, I believe is what.
Yeah, we call it the
What it's
dispensary
called.
program subcommittee. I think.
It's called dispensary instead
Yeah.
of Medical Marijuana Dispensary?
Yeah, we kept it short to
Okay.
dispensary program.
Okay.
Those acronyms always mess with people, you know? It's so much easier to know what dispensary.
There's one other place where that occurs, but no biggie.
Great. Anyone else have any other amendments or clarifications? Okay, great.
And good job on the minutes too.
Yeah, again, but Tracy, they're amazing.
So I move to accept the minutes as corrected. I second.
Great. All those in favor of approving the minutes as stated with amendments from Todd?
Aye.
Objections? Any abstentions? Okay, passes unanimously. Oh, actually, Jerry,
Yes.
are you an aye or an A as far as?
I am an aye.
Aye, approval of minutes, okay, great. Okay, then it does officially
Thank
pass
you.
unanimously. Thank you. Okay, great. And then, I guess, on to the uninterrupted administrative reports and program updates from all.
Okay. So currently, personnel, we're currently, have 24 permanent employees. We're recruiting for 3 positions. We have a couple people that resigned. And since Megan's in an interim manager's role, we're recruiting for interim law enforcement liaison, same as administrative specialist 2 position, to backfill her position while she's performing the duties of manager. Also, we now, Steve Wagner is our new administrator for the Center for Health Protection. So Dave is back in his role for drinking water.
And what was his name again, I'm sorry?
So Stephen Wagner, he worked for the Department of Ohio, the Ohio Department of Health for 25 years, and most recently there he was administrator for the Division of Prevention and Health Promotions. He held roles in preparedness, environmental health, toxicology, and epidemiology, and he also has a law degree and his master's in public health and epidemiology. So he comes with a background around, a strong background around regulatories and enforcing agencies and preparedness. He may be here this afternoon, but he had another engagement that trumped this meeting. So, what else I want to say about Steve? I think that's it.
Is that, you want, so that's the entire program?
No.
Oh,
I was
okay.
looking at what I was talking about. So I just want to give an update on some of the projects we mentioned last time that we're working on to empower the patients and get them to understand the program better and stuff. And so we are no longer doing the newsletter, but instead we're enhancing our webpage, which is in process. There's some revisions that are already been in place. You may have noticed out there with the basic facts. But it should be completed about the end of January. We also, did I say that? Yeah, about the end of January. And then the fee brochure, it's been developed, and so it should be ready. It's in the design phase now with the Cubs, and so then that should be available by the end of January. And what we'll do is insert those in the renewal packets, and if people call and get, what's it called? What am I trying to say? The other thing that we're going to put them in. Incomplete letters, thank you. So if there's incomplete letters, we'll put them in there so it can better, so the patients can better understand because of our crazy fee structure. And the handbook has been revised and updated, and it's in the design. It's in Pubs also, so that should be ready about the mid of January. And then we're also creating an application handbook, so that would explain how to complete the application and the processes, so they can clearly understand that. So it's different than the patient handbook, and that's in process. And then once the application handbook and the other things roll out, we'll start working on the trainer workshop. And that's it for the project updates. Any questions around that?
Training the trainer, is that for primary facilities and owners and so forth to attend?
That was something that didn't either sure or.
Would you like me to speak to it?
Yes, please.
Okay. Sarah had, when I asked you all about the newsletter brainstorm, so part of that, Sarah had mentioned that it would be a good idea to do a workshop on the application process. So we're developing all these different documents to help patients get through it more successfully, move through the process more quickly, and understand everything. And once we have that, we want to do a train the trainer workshop where we train interested parties from clinics. Ben has said that some of you might be interested in helping us, or we would help people who help the people fill out the paperwork. So we're all on the same page.
No, that's awesome.
And we hope to roll that out in Q1.
Okay.
Thank you, Tracy.
So had the newsletter ever been published? So I've never seen one. So,
No,
okay.
so we submitted it to communications, and after looking at it, what we're trying to communicate out to, it wouldn't be in the form of a newsletter. So we better to do it through the webpage.
And so I know historically when we've tried to get things on the webpage, it takes months and a lot of approvals from higher up. So would you be able to edit, to publish articles and things without a lot of, I can imagine.
Everything that we put on the webpage will have to go through the approval process.
Okay.
We have to make sure that there's,
So like every article, you can't just say that this space is for timely articles and things like that.
what type of articles are you talking about? Like,
I'm just kind of thinking with an editor's head. If I wanted to get a publish a newsletter article, usually newsletters are kind of like timely. And so if it takes months to get an article approved to be published on the website, I could see how that would make it difficult to publish a timely article. So it's just maybe.
Do you mind if I?
yeah.
So the first piece of the revision of the website is really reorganizing it to make it easier to A, find information, and B, for people to understand it. So we're lowering the reading level, and we're making things easier, adding infographics, lots of blanks, easy helping tools. So first we're going to do that. We're going to change the menu to basically audience-based to target for new applicants, card holders, and physicians. So that's the first piece. We would like to have current information on the front page, but that's still in the, so that's where we are with that.
But yeah, bottom line, someone's gonna have to review the content of an article, since it is going out on a state publication. It's a little more sensitive than, say, usually newsletters are for groups like WIC or agencies that are recruiting and trying to get people services. So I think they see our program a little bit differently than that, but
They don't see us as trying to get services.
well, no, we're a registration program. So I don't think we're seen as a group that we're not necessarily a group that goes out and outreach and try and attempts in the same sense that like folks that are trying to get people on SNAP assistance or healthcare. We just weren't set up the same way as that. It's not that there's necessarily an opposition to that. I just think it would have to be reviewed for content.
So did it get sort of run up the flagpole and rejected the newsletter?
The newsletter didn't get rejected.
It was tabled.
It was just tabled, but they think it would be better for us to get our information that we're looking to put out in there through the webpage. And that was like restructuring our webpage and giving the information that way, and then doing the handbook and the e-brochure.
But you do understand that right?
Yes.
So
Yeah.
pointed out that basically it defeats the entire purpose of a newsletter to put on the webpage. And additionally, we have had a historical track record, and the historical is currently to date historical. Like I had a person who wanted to come to this meeting call me, and if they didn't have their cell phone because they looked on the website and didn't think there was a meeting, because nowhere on the website is our meeting.
There is an area on the website
Well,
with our meetings.
I'm just
We
saying
never
there's-
got informed, we had to call the office to
Yeah.
get the information about the
Well,
meeting.
this meeting was on the website.
Well, that's what I'm saying, but whatever the case is, what I'm stating is that I'm not saying it wasn't on the website. I honestly didn't check, but what I know is a citizen that wanted to come here had to call me to find out if it was going. Instead, they looked on the website. So what I'm saying, the point that I'm trying to get at is I'm not saying that it's not on the website. What I'm saying is that
It's hard to find. Okay,
it's hard
so
to
and
find,
that's
and
what
we're
we're
adding a
working on.
bunch more data, and then what we're doing is the reason for newsletters to streamline in current events.
But they're gonna change the way you get to things, and so
I think
that
they
is a
already
problem.
have,
It's
right?
under
Yeah.
public meetings instead of under ACMM. And so if you just have a link to that, and I assume that's one of the things you're working on.
Correct.
So it's always been a problem finding the meetings if you don't know what to look for.
Right.
So what they're doing is they're just
We're restructuring the website to make it easier for the patients to find the information they're looking for. So that is one of those things. But it's there. It's that the person probably didn't know how to get to it, and that's what we're working on improving. And as far as articles getting approved, we have a different structure with publications. I mean, not public, the communications, and so we send it to those individuals. It wouldn't take months and months in order. We can change things like with just to update the and putting the meetings on there. Well, we don't need approval for that, but for a specific article or something like Karen was saying, it's reviewed for content.
And is it that same requirements under
Under what?
Under newsletters, it would still take the same review process as it would.
That's the-
websites,
correct.
No matter what, it would be the same review process.
Correct.
Thank you. Thank you for that.
Did we answer?
Yeah.
Okay.
Just a question, was that last beep someone else joining us,
Yeah.
or was this just making noise?
Did someone just join
Did
us?
someone join the meeting on the phone?
Oh, come on.
Like I said, one more.
Hey, there you are.
Hey, Brian, how you doing?
You did join us.
Yeah, I've been here for a while, but just getting on you, just like you heard, I'm getting in the
That's
All
Brian.
right.
Mike.
Thank you for being on, Brian. I appreciate it.
I just want to follow up one thing with the news. I think, one thing that I was excited about when Tracy called and asked me for ideas about the newsletter was it sounded like there was going to be some, good, useful information, things that are timely, and I was, really excited that she was taking on that project. And I am very happy that the website will be made more user-friendly and everything like that. But then, I think my excitement, about the newsletter, I don't think that.
Excuse me one second. Is this going to be a question, or are you just stating an opinion? Because this is uninterrupted, and I asked for clarifying questions related to that. But if you,
Okay.
is that just going to be an opinion about what you feel about it? Because I asked for clarifying questions. I don't, and this is uninterrupted.
Okay, I could wait until dialogue.
Okay. Thank you.
Is there any other things you'd like to then on that?
So, the stats.
Yeah, so I see that the stats were there, so the public has them. I'll just go down through them really quickly. But so we currently have 70,128 patients on the program. little over 35,000 caregivers, and currently just over 47,000 growers. There's the stats there with the number of registration applications where a patient lists him or herself as a grower, about 38,300. And then the number of registrations where a patient lists someone else or doesn't have a grower is about 33,200. There are currently 1,637 physicians with a patient on the medical marijuana program. And then you can see the number of out-of-state participants, about 1,600 patients, 600 caregivers, 600 growers. Again, you can't have a grow site out of state, but you can be a grower and live out of state. And then the condition count, you can sort of just get an idea of the most common conditions, least common conditions, and then just at the end to just sort of give an idea. Severe pain is obviously represented on most registrations, but the number of applications we receive where that's the only condition is about 39,000. Just to give you an idea. And then on the back, page 7 just gives you an idea of how many people are at the number of people at grow sites. You can just sort of get an idea that means there are 25,000 grow sites with just one patient. For example, 1,300 grow sites that have 4 patients, and so on. That's messages. Any questions?
Any questions?
Yes.
Oh.
Yeah.
My boss was just interested if we could find out how many people on the program are currently on the Oregon Health Plan.
So we can definitely tell you how many people applied paying a reduced fee based on the Oregon Health Plan.
Okay.
If you're on the Oregon Health Plan and you didn't let us know that, or
Right.
we wouldn't be able to tell you that,
Yes.
but it would probably be a pretty accurate idea. Yes,
Uh-huh.
absolutely.
Okay.
And we break that down by
Sometimes she
fence
has that.
and SSI payments.
Okay, budget review, we do not have a report this month. The Public Health Division's Deputy Director has requested that any financial information reports are postponed until January, to allow the financial services and staff there to do an in-depth review of the projected revenue and expenditures and estimated imbalance for 2013 to 15. And this is due to the release of the governor's balanced budget and the Public Health Division's budget and financial analyst being assigned to other work over the last 2 weeks. So at this point, we don't have a report, and that you can expect one in your next meeting or in January.
So, and then can I just back up one
Mhm.
second?
Mhm.
Address that too, but were we gonna go over this, or are we gonna go over
This
any other
is-
statistics, or is that gonna be a
This
separate?
is, Aaron, did you want to read?
I just didn't know when the statistics
Just
were
something,
in the
it's
other.
not necessarily part of the statistics there, but it gives you an idea of sort of the trends, just to kind of give you an idea of where
Yeah.
we peak, where our,
And what you're saying is there will be there's no budget.
There's not a budget report
Gotcha.
for this time. Did you want to go over this part of statistics?
Does anyone have any questions about the trend? I think it's explanatory.
It's already here.
But I mean, we're not seeing a drop off.
Yeah, exactly. Yeah.
And the highlighted line is just to show you the difference from last year at this time to now.
Yeah.
I'm wondering,
So
have
they
you
had a
been
draft
receiving
that
any
they didn't give us.
questions from the public or patients, regarding the future of the OMMP, in the context of Measure 91, or any questions like that?
We do. We receive a lot of phone calls about that. That's obviously people are curious, and who else are they going to call? So we, if they have questions about the recreational retail use, we forward them to OLCC because they want to handle those questions. We really don't know what the future is, so that's sort of the bottom line answer, kind of like what people over here. We don't know what the legislature will do. We don't know that people will want to continue participating on the program. So we know about as much as the public, unfortunately, but we do obviously receive a lot of calls from folks concerned whether they should renew, that sort of thing. We don't really have an answer. I mean, other than if they have a specific question about how Measure 91 is going to work, we know to refer them to.
So is that because I sound like we're getting into the dialogue now, which is great, but it's not a bad thing. I just want to check to see if there was any other thing from you to want to, that's the uninterrupted report, keep the uninterrupted you have. It looks like we don't have a budget update. We've gone over the statistics in the program. Were there any other items you want to address?
Just for travel claims, I stated I would always provide you guys with the per diem, and of course, again, you're in Portland, so the per diem for hotel is $113 per night, and for meals it's $66 per day. And just make sure you guys keep your receipts for parking and your hotel and taxi. And if you used any copying those type of receipts, but you don't need a receipt for your meals. And you guys all have the current travel claim. Okay. The instructions are also on the second tab. You keep it electronically.
Okay. Anything else, or is that?
Let me see. I want to see if we talk about term limits on the rest of the agenda. Okay, so then I need to, what do you do? So the terms for Sandy, Laird, and Jerry in December 31st. And Jerry, if you're gonna want to continue another full term, because you can do 2 terms and you've only done 1, you would need to reapply. And I also want to talk about, we've only received 5 applications, so I would like to open to extend that, if being that we need to fill 3 vacancies if he doesn't reapply. So I'd like to extend the application timeline, the deadline, to the end of December. if that's okay. 'Cause
So, just to review, so Sandy, and you say Laird?
yes, Sandy and Laird.
So they're termed out at the end of the year?
Yes.
And Jerry is not coming back, or?
I don't know, he did not reapply again, so Jerry, you have time to reapply if you plan on, keeping your appointment on the committee, because I'm extending it to the 31st of December.
Jerry, did you hear that? Are you on the line, Jerry?
Yeah, I'm on the line. I couldn't tell if that was referring to me. It sounds like I need to reapply, is that correct?
Correct.
Does she have the paperwork that she can forward to me so I can reapply?
Yeah, we can make that happen.
It's online,
It's on the website.
It's online?
it's on the website. And it's
If
under
you would do me a
Lisa.
favor and just forward that to me, that would be so much easier than me struggling online to find it. I would be happy to reapply if the board would have me back.
I'll send it to you after the meeting.
That's Tracy. Tracy will give it
Tracy.
to you.
Okay, very good.
Thank you.
Thank you very much.
Is there anything else you want to
I'm trying to make sure, 'cause
We'll do it. We can get back
I
to
wanna
it.
make sure I hit everything.
We'll get back to it later because we're at 10:30 and we can address it in
That's fine.
the dialogue
Yep,
between
go
the
ahead.
ACM.
I think I'm good. Go ahead.
Yeah.
combinations.
Great. So, open it up. Does anybody on the committee have any questions for the